And the irony is now that we have access to vaccines, you have people who are hesitant about taking the vaccines, and others are just totally ignorant in their position about becoming vaccinated. Many of them are opposed to vaccinations when they already have a lot of vaccines in their bodies that would have protected them from a number of different diseases. In fact, many of them are alive today, primarily because of those vaccines that they received as a youth. Now, the active COVID cases, I'm told, they're down now to 22, which is very good. And, we want to get on the 20. On the 20 will be quite a positive signal. And I hope that the fact that we're seeing a significant reduction in the active cases, that individuals do not become complacent and decide to throw caution to the wind, because COVID is still very much present within the society. And all it takes is a super spreader at one event to spread the virus exponentially. Now, several more deaths are to be added to the dashboard. I would have signaled that, I believe, about 2 Saturdays ago. My understanding is that the audit has been completed, and as a consequence, this will take our COVID deaths closer to 40. I'm told that there are a number of them that are somewhat inconclusive in terms of the cause of death. And I'll give you a typical example. There's one particular individual who was actually killed in a motor vehicle accident, but was positive for COVID, tested positive for COVID. Now, COVID did not kill the person, but the fact that that person was part of the active COVID cases, in order to ensure that the numbers balance and no one accuses us of fudging the figures, they may well have to include that death among the COVID deaths, even though that person did not die of COVID. Similarly, there's another person who died of a heart attack and tested positive after death for COVID, but there's no conclusive evidence that is the COVID that killed that person. But again, out of an abundance of caution, health officials may have to include those in the deaths. It means, therefore, that we'll be closer to 40 deaths. And it shows very clearly that COVID is debilitating and deadly. Even here in Antigua and Barbuda, in such a small population, to have 40 deaths out of 100,000 people, it's a lot. And if I'm not mistaken, only St. Lucia has more deaths per 100,000 than Antigua and Barbuda. I believe the total deaths in St. Lucia is about 76. But again, it shows that our people are very vulnerable, and it necessitates the population getting vaccinated in order to achieve herd immunity, because we're far more vulnerable than many other countries in the world. We have a very high prevalence of obesity and diabetes, and those rank among the best allies of COVID. And as a consequence, if we're to get a third wave, which is not unlikely, there'll be lots of deaths. There'll be lots of hospitalizations. We have gotten a warning already. We saw what happened in January, or between January and April. And if that is not enough to convince our people that they need to get vaccinated, then evidently we have a problem in the society. But that's a matter for us to address at a different time. All I will do at this point is to urge everyone who has not been vaccinated to get vaccinated as soon as possible. Now, worldwide, there are 162 million cases, up 4 million from the previous week, and there are 3.36 million deaths. So that's an increase of about 160,000 deaths globally. But we know that the situation in India is dire, and they are contributing significantly to global cases and to global deaths. So active cases globally are now 17.6 million, but down by about 800 cases from last week. Now, that is very instructive, because when you look at the fact that India is actually contracting COVID cases, or have COVID spread to the extent of about 400,000 individuals per day, it is rather instructive that there's still a reduction in active COVID cases globally, which shows that the vaccinations are working. So we need to continue to pray for our brothers and sisters in India, because the situation there remains dire. And then later I'll speak about the situation in Trinidad and Tobago, which is really very challenging for the government there. Mm-hmm. And it seems as though that in Trinidad and Tobago too, that people did not quite heed the warnings of the government. Many individuals took COVID for granted, and as a consequence, about 1/3 of all the COVID cases, almost 4,000 COVID cases, have been contracted within the first 2 weeks of this month in Trinidad and Tobago. So individuals need to listen to their leaders and not to follow those anti-vaxxers and those super maniacs who look at attention, but to understand that this is a serious challenge facing countries globally, and it requires a collective effort of all of us so that we can bring this debilitating and deadly disease under control. Mm-hmm. Now, again, I want to also caution our people against any premature declaration of victory, because even though we're down to 22 cases, and maybe in the upcoming weeks, we may see a reduction perhaps down on the 20 and maybe single digit, COVID is still a significant threat. Our borders remain open. And in addition to that, we have people here who have COVID. So if the spread increases significantly, and rather worse, if the existing variant here mutates into a more deadly variant, then we're going to have a significant problem. That is why it's so important for people to get vaccinated. I cannot overemphasize the need for people to get vaccinated. Vaccinations remain, the best among the weaponry that we have to defeat COVID.